Administering medication to children is often far from straightforward. Many young patients refuse to take standard prescriptions, whether due to unpleasant taste, difficulty swallowing pills, or specific allergies. For parents and caregivers, these hurdles can turn routine treatment into a daily struggle. Children's bodies are also different from adults, requiring careful attention to dosage, ingredient sensitivities, and delivery method. In many cases, commercially available medications simply do not meet the unique needs of pediatric patients. This is where the science of pediatric compounding steps in, offering a solution that is both innovative and compassionate. Pediatric compounding pharmacies create custom medications for kids, ensuring that every child receives the safest, most effective, and most palatable treatment possible. Pediatric compounding is the art and science of preparing personalized medications for children. Unlike mass-produced medicines, which are manufactured in fixed dosages and limited forms, compounded medications are crafted specifically for each child based on a doctor's prescription. A pediatric compounding pharmacy works closely with healthcare providers to adjust dosages, remove allergens, and create formulations that are easier for children to take. Whether it is converting a tablet into a liquid, adding a kid-friendly flavor, or eliminating problematic ingredients like dyes and preservatives, the pharmacy's goal is to make medication both effective and child-appropriate. This customized approach helps ensure that children receive the precise treatment they need, in a form they can actually use. A pediatric compounding pharmacy plays a vital role in children's healthcare by tailoring medications to each child's unique requirements. The process begins with the doctor's prescription, which the pharmacy carefully reviews for safety, dosage accuracy, and compatibility with other medications. The pharmacist then selects the active pharmaceutical ingredient and ensures the formulation is free from allergens such as gluten, lactose, or artificial dyes. Depending on the child's needs, the medication can be prepared as a liquid suspension, a flavored lozenge, a topical cream, or even a gummy or lollipop. Each compounded medicine is meticulously measured, mixed, and tested for texture, solubility, and stability. Quality control is paramount. Pharmacists conduct sterility and stability tests to ensure safety and efficacy. Finally, parents receive clear instructions on dosage and storage, making the medication process as smooth as possible for both child and caregiver. Safety is at the heart of pediatric compounding. In Canada, pediatric compounding pharmacies are governed by strict regulations to protect patients. The National Association of Pharmacy Regulatory Authorities, or NAPRA, sets national standards for compounded prescriptions, while provincial bodies like the Ontario College of Pharmacists oversee local operations. Health Canada's Good Manufacturing Practices, known as GMP, ensure that all ingredients used in custom medications for kids meet rigorous safety and quality requirements. Many pharmacies also follow the United States Pharmacopeia, or USP, guidelines for best practices in both sterile and non-sterile compounding. Key safety measures include precise dosage adjustments, complete ingredient transparency, compliance with sterile compounding standards for injectables or eye drops, and ongoing collaboration with healthcare providers to ensure the best possible medication alternatives for children. Despite its benefits, pediatric compounding is sometimes misunderstood. One common myth is that compounded medications are not regulated in Canada. In reality, licensed pharmacists must prepare all compounded prescriptions according to strict provincial and national standards. Another misconception is that compounded medications are unsafe for long-term use. In fact, every compounded medicine for pediatric patients is prepared following rigorous safety and stability protocols, with parents informed about proper storage and expiration. Some believe only adults need compounded medications, but children often benefit the most, whether due to dosage adjustments, alternative forms, or flavoring to improve compliance. By dispelling these myths, families can feel more confident in the safety and value of compounded medications for their children. Many medical conditions in children require a custom approach to medication. For example, children with attention deficit hyperactivity disorder, or ADHD, may need precise dosage adjustments or alternative forms like liquids or gummies. Those on the autism spectrum often have sensory sensitivities and may refuse medications due to taste or texture, making flavored or transdermal options highly beneficial. Children with gastroesophageal reflux or digestive issues may need medications in liquid form, free from sugar or preservatives. For skin conditions such as eczema or diaper rash, custom creams without allergens can provide more effective relief. Pain management, seizure disorders, and allergies also benefit from compounded options, as pharmacists can create hypoallergenic formulations and tailor strengths to the child's specific needs. In every case, the goal is to ensure children receive the safest, most effective treatment possible. The true value of pediatric compounding lies in its ability to provide personalized care. Every child is unique, with individual medical histories, sensitivities, and preferences. By adjusting dosages, removing unwanted ingredients, and offering medication in forms that are easier to take, compounding pharmacies help improve treatment compliance and outcomes. Flavored medications can turn a daily struggle into a manageable routine, while alternative forms like topical creams or transdermal gels offer solutions for children who cannot take oral medications. Collaboration with healthcare providers ensures that each compounded prescription is safe, effective, and tailored to the child's evolving needs. This commitment to customization supports families and empowers children to receive the care they deserve. Choosing the right pediatric compounding pharmacy is essential for your child's health and safety. Look for a pharmacy licensed by the appropriate provincial regulatory body, such as the Ontario College of Pharmacists or the College of Pharmacists of British Columbia. Accreditation from organizations like the Pharmacy Compounding Accreditation Board, or PCAB, is also a sign of quality. The pharmacy should have extensive experience in formulating customized pediatric medications and be transparent about the ingredients used. Collaboration with your child's doctor is crucial to ensure the correct formulation and dosage. A reliable pharmacy will offer a range of medication forms, from flavored liquids to topical creams, and follow strict safety standards such as Health Canada's GMP and US guidelines. By prioritizing these factors, parents can ensure their child receives the best possible care. Parents often have questions about compounded medications for children. Yes, a prescription is required for all compounded medications, and pharmacists work closely with doctors to tailor each treatment. Flavored medications are available using safe and child-friendly options like strawberry or vanilla. Compounded medications are safe when prepared by licensed pharmacists following strict safety protocols. Unlike standard pharmacies, pediatric compounding pharmacies create customized solutions for children who struggle with commercial medications. Each medication has a unique shelf life, with storage and expiration details provided. Insurance coverage varies, but some plans and health spending accounts may help with costs. Ultimately, choosing a licensed, experienced compounding pharmacy ensures your child receives effective, personalized, and safe treatment.